Yeah, she's like, go get her.
So enthusiastic and positive. He's got a good one about him. Oh, God bless him.
All right, I think we'll get started. I'd like to welcome everyone to our press conference, COVID press conference today. Today we're joined by Dr. Bill Remington from the Kosciuszko County Health Department and Kurt Carlson, CEO of the Bowen Center, who's been instrumental in our testing. We've got a lot of things to talk about today, and I think we'll change it up a little. I think we'll start talking about the testing and where we stand right now. And then we'll start with Kurt, and then we'll move to Dr. Remington to talk about locally where we stand, our current numbers, the county designation, and then have some discussion about vaccines. So, Kurt, if you want to start off and talk a little bit about the testing today.
Yeah, it's slowed down much since earlier on. We had long lines and all that, and now we're down to testing a little over 500 people per week. That's down from a high of about 1,700 per week. And it flows pretty steady, so the line isn't long. Had an incident recently where somebody stood in a line only to find out they were in the line for the food pantry. And so when they came for testing, they got eggs and butter and things like that. So and they just laughed at themselves and they got it right line. So I guess there's more than one thing going on over the fairgrounds. So yeah, you don't want to show up for groceries and end up with a swab. But again, still a significant portion of the Latino population, the Hispanic population, are coming to the test site, and so it's a privilege to serve them. And maybe I'll just mention, leading by example, I've got my first COVID shot through the health department. It was very simple, easy, quick, painless, and get my second shot in a few weeks. But then, as I've said to my staff, I intend to wear a mask probably for the rest of this calendar year at least, because even though I may not be susceptible to getting it, I may still be prone to spread it, and that's the last thing I want to do is transmit a disease to anyone else. So I made a commitment to continue to wear the mask even after I've gotten a second shot, and I've certainly encouraged my staff to do the same. So that's kind of it for testing these days.
Kurt, could you just quickly remind everyone of the hours that you're operating at over at the fairgrounds?
Yes, on Saturdays it's shorter hours, it's 9 to 3, and then either 10 or 11 o'clock we open during the week, and then we close between 5 and 6 depending on the day of the week. Okay. So you wouldn't want to show up before 10, and we'll certainly be done by 7 at the latest.
And no testing on Sundays, correct? So you're great.
Nothing on Sundays, and when we have holidays come around, sometimes we have abbreviated hours.
Okay. All right. Fair enough. Great. Well, thank you. Thanks, Kurt. Appreciate all you're doing. I know your staff has endured so far not too bad of a winter, but being a drive-through clinic, I know that's grueling, and especially when you guys were hitting those high numbers. So thank you all for
be able to be at the fairgrounds. So I appreciate the combined effort to allow that to happen.
Yes. So Let's move to Dr. Remington from the Health Department to talk a little bit about the status of our county, which will be released, I think, at noon today, and then talk about our local numbers, and then maybe get into discussion on vaccine and whatever else you feel is important. Dr. Remington?
Well, thank you, Mayor, for inviting me again. We continue to have robust COVID case counts and positivity rates in the county. The State Department of Health has designated us a red county again this week. So please, citizens, be vigilant with masking and social distancing, avoiding crowds, and good hand hygiene. And as Mr. Carlson mentioned, even if you have been immunized with COVID vaccine, continue to do those things. It is not clear whether immunization keeps you from innocently spreading viral transmission from you to somebody else, even if you are not clinically ill. So I know it sounds like a marathon here, but please continue to mask, and I think we'll be asking people to do that for months. The bright spot is vaccine. The health department immunization site is going very well, so hats off to our chief nurse, Jeannie, and her putting that together. We are in a position of only being able to give what the state allocates us, and we have given every single dose that they have given us. We're averaging over 100 doses a day through our clinical site at the K21 Medical Pavilion in Warsaw. It's all scheduled, so you just don't show up and get a dose. You have to schedule using the state's scheduling site, which is, I think, easier than using the 211 phone number. You simply log on any browser and put rshot.in.gov in, and it should direct you to the site. Our site vaccine slots have filled up quickly. If you find that you cannot access vaccine, you can play around with zip codes in our vicinity to see if you can find a clinic with some scheduled slots available for you, not too far of a drive away. Also, just keep checking back on our site every 2 or 3 days or so and see if you can schedule a visit with us. We hope to get more vaccine. We've let the state know we could accommodate more each day, and we would be very anxious for more vaccine. There may be some other venues of vaccine coming online. Stay tuned to that. It's all extremely dynamic. We don't have much of a heads up as a local health department, so stay tuned particularly to the governor's press briefings and news outlets as to the latest with COVID vaccination in the state of Indiana. We do look for the new federal administration putting fresh eyes on this, so state-by-state allocation and state-by-state responsibility in allocating within their state borders will probably change. I believe Homeland Security will be coming in a stronger position, and I believe we'll see more involvement with national chain pharmacies in the weeks to come. So please stay tuned. But it's going very well, and just to say again, I have been most impressed with just the affect in the room around people receiving vaccine. It's a game changer for them. Very positive. People are talkative, they're excited, just having opportunity to have their first dose of COVID immunization. It starts to open up their world. Grandparents thinking now maybe they can have some visitation with grandchildren, not feel so vulnerable, that kind of thing. So I think if we really want to see community change and impacting families, businesses, the quicker we can get to robust immunization rates with COVID, the better. It's very impressive to sit in our vaccination site and just take it all in. Very favorable. Vaccine's very safe, very effective. You hear some anecdotes of some people with local site injection soreness, maybe a low-grade fever, and not feeling very well for a day or two, but very minor side effects to the vaccine as it stimulates your immune system. Again, there's nothing live in these vaccines. These vaccines that we have now will not give you a COVID infection. And they do not change your genetics forever. Very safe, very thankful for them. We need more. Thank you.
All right, thank you. So I know before we got on this morning, we had some discussion, and I think Dr. Remington said it very well. You know, right now the limitation is with the number of doses that were being allocated, and we expect that that will expand at some point. When that happens, we certainly want to be ready. We want to make sure that we have ample sites to deliver those doses as they become available. We've talked about some alternate sites, talking about the pavilion potentially out at the armory, but at this point, we're just trying to be ready when the doses are allocated. At this point, there are no plans, immediate plans for those sites to be active. As Dr. Remington mentioned, the health department is doing a marvelous job out at the K-21 pavilion, scheduling and being able to deliver doses as they are allocated. And I was very impressed that, as he said, there hasn't been a dose wasted. And as unstable as some of these things are, when they start to unthaw, that's pretty impressive. So hats off to the health department for basically taking what we've been given and making great use of it in our community, getting into the arms of those that need it the most. So with that being said, again, we are making contingency plans so that when we get a call that there are potentially more doses available, we're ready to move immediately. And that's our role right now is being ready. But again, at this point, we are limited by the doses that are being given. And as, again, Dr. Remington mentioned, there are a lot of different factors that will come into play as far as when we get a call. I know Mr. Weaver over at the health department is behind the scenes handling a lot of that with the State Department of Health. So we'll just continue to do what we do and move ahead. We do had some discussion about some of the education on the vaccine, the important points that we want people to understand, the science behind the vaccine, the importance of it, the safety of it. And, you know, those are things that we will continue to, through public information, try and disseminate. City of Warsaw, our website, we've set up a page. It's warsaw.in.gov/vaccine, and it's got several videos on there that are done very well. They explain it in a very simple way with some graphics, and I watched 2 or 3 of them yesterday, and they're very good. So if you have the desire to understand a little more what this is all about, it's warsaw.in.gov/vaccine, or you can get to our normal website and find that page that is up now. So appreciate if you'd take a look at that. I do have, looks like I've got a couple questions that have come through. This one is from Nick Duranick at News Now 1480. This is for Dr. Remington. Some people are worried about the side effects from the vaccine, as you just listed off some of those. Is there any reason medically why someone would not be able to get the vaccine?
The most respectful issue is someone who has had a very serious allergic reaction to an injectable medical product in the past. We would not give a vaccine to that person without some consultation, perhaps, with their allergist or their medical physician. Anaphylaxis is rare. That's probably been one of the bigger talking points around the vaccine, and probably related to one of the vehicles used around the messenger RNA, polyethylene glycol, which is in other injectable medical products. So an egg allergy or a food allergy or a bee sting allergy would not prohibit someone from receiving the vaccine. Someone who has just had a COVID infection and are still within their contagious period, we would ask that they not come in for a vaccine. After their contagious period, after that 10 days from the onset of their illness, it's appropriate for them to be immunized. It does not hurt them, nor does it immediately help them, I would say, to be immunized. It doesn't change the course of their COVID infection. There is no hurry after a COVID infection to go get vaccine. You have good antibody protection at least for 90 days and probably longer. So as I've mentioned before, you can step more toward the back of the line. The CDC on their website has a color-coded grid as to indications or potential contraindications for the messenger RNA vaccine. It actually lists the products that are in the makeup of each of the two vaccine products we're using now. Anybody with a severe allergy to a previous medical injection should look at that specific part of the COVID vaccine information on the CDC website. It's 2 or 3 pages long, and there should be a color-coded graph at the bottom if you just scroll down. It's one of the best singular pieces for information.
And
Great question.
the second part of that question, for those who are worried about those side effects, what would be your message or recommendation to them?
Yeah, so the reactogenicity of these vaccines is a talking point. It does happen. It activates your immune response. That's what we're after. Some people, particularly younger people, with the second dose will have more of them. The generalized achiness, the headache, maybe a fever. They are self-resolved within 24, 48 hours, and using over-the-counter fever-reducing medications or pain medications would be appropriate. They are very mild. I have not heard of any severe reactions from our immunization efforts here at our health department. But they do really exist. So plan your day. If you think that there's some potential it would impair your ability to go to work the next day, you might think of that as you schedule your dose of vaccine, and schedule it at a point where it may not prohibit you from going to work the next day.
All right. This question comes from David Sloan at the Times-Union. For Kurt, with the coming of the vaccine, has the mental health of the community improved? And what kind of mental health concerns are people expressing at this time regarding COVID?
Interesting question. Thank you for that. There are people who, as they have seen the vaccine on the horizon, have gotten signed up for it. It is, I think as Dr. Remington had mentioned, a relief, a hope, and so that's a good thing. There are people who are skeptical, and I don't think the coming of the vaccine has helped their outlook at all, if they just don't think that this is something that they want to do or that it will help. But yeah, I think I've certainly heard a lot of enthusiasm by people who are looking forward to or have already gotten the vaccine. So yes, there has been some light shed at the end of that tunnel as people have seen it coming and then gotten injected themselves.
Kurt, I know you and I had a little discussion this morning about some of the mental health concerns that you've seen as we've kind of fought our way through this thing, and you'd made mention of a few things. Would you mind sharing what we talked about this morning?
Sure. I heard a national article yesterday and a state article today expressing concern primarily for children, that when children are in school, teachers have their eyes on them. The Division of Children's Services for a while was not making home visits. Probation was not making home visits, and so there was a lot of concern about the mental health of children deteriorating and nobody being able to recognize that. Stressful for the parents. Frankly, sadly, there could be an increase in child abuse as a result of the stress of this pandemic and having to teach the kids at home. There was concern about the increase of kids coming to emergency rooms and maybe being hospitalized for psychiatric conditions, higher rate than before the pandemic. I don't know that we've seen that locally. Bowen Center has kept very active during this pandemic. We've continued to provide psychiatric services remotely, and actually our psychiatrists are right from the beginning treated more patients per day, per week than they had prior to, because if no shows and cancellations are eliminated by telephonic or other visual electronic aids, somebody's car breaks down, instead of canceling the appointment, they get on the phone and get the service. If the child is sick, instead of calling in to cancel or postpone the appointment, they can get the service. And so it really has totally decreased the no-show and cancellation rate, and the same thing with our therapists. Now, once we could go back safely in the community, as we were following the governor's rate of reopening, again, we socially distanced, wore masks, and we're seeing an awful lot of families. But one of the most interesting things, as Bowen Center had developed years ago, an employee assistance program for employers as a way to help salvage employees who might otherwise have to be terminated or self-terminate because of life stresses, and get ready access to prepaid mental health services. And then we did the same in schools, student assistance program. And this has been an overwhelming demand by schools to get these SAPs or student assistance programs. And they're being highly used, more highly than ever before. So Bowen Center is trying to do our part to address the increase in emotional stress that children and families have suffered. Now, there's still some schools that out of an abundance of caution are not letting anybody in the school other than the faculty. And so those schools we have to serve then either remotely or after school. Other schools are letting us in, welcoming us in with open arms, seeing the value of the services we provide to assist the teachers and those kids, especially the kids who are more marginalized, especially the kids who struggle the most. I know teachers and faculty in schools are very concerned about those kids who are already lagging a bit behind, who then that gap just keeps widening and widening. And we're trying to help with those, but sadly we can't get to everybody. But yes, it is a serious concern.
All right, thank you. Dr. Remington, I know earlier today, in some of our discussions, you had mentioned that the scheduling can fluctuate a little bit at the local clinic, and potentially if someone can't find a slot, maybe to check back again as far as maybe being able to get into our local clinic. And I know it's been tough. Reports I've heard is that with most of our slots being filled, there's long waits on the 211 as well as the rshot.com. But I know I would, I guess, suggest that folks continue to try, and there might be some openings created. Can you give us a little update on that or your thoughts?
Yeah. I believe that ourshot.in.gov is still the go-to place as far as a gateway to vaccine. It is not perfectly clear to us, I must be honest, as a health department, how this all works. That is, our vaccine allocation, we're not ordering vaccine as a health department. We did not create the template for the scheduling software from the state. That was all handed to us and is really in their domain. So the thought would be that if we are allocated more vaccine, that the available slots would open up on the scheduling software pretty quickly. So I do believe, as I listen to the State Department of Health strategy with this whole thing, number one, it remains a scheduled thing. You don't just show up at a vaccine site in the state of Indiana and receive a vaccine. You should be scheduled. And it flows best, they are resourcing it best through the website. 211 can be used, it's cumbersome. I hear a lot of anecdotes regarding the poor flow there. It can be frustrating. If you do not have immediate access to online capabilities, or you just don't like computer things, find an advocate for you in your circle of friends or family that can help you log on. And if you are frustrated today, let's say you cannot find a scheduled slot available, then try back in 2 or 3 days and do it again. This whole thing is really dynamic, and we have hardly a heads up, if any, even as a local health department with much of this. So use the online registration. Don't give up. Keep looking to that. Get some help navigating that if you need it. And just hang in there. There is light at the end of the tunnel. It's a little bumpy. This is unprecedented in its scale for the state of Indiana. They have never had a mass immunization campaign like this. And here it was, rolled out in the midst of a holiday period, and yet today there have been over 300,000 doses of COVID vaccine given into arms in the state of Indiana. I think that's amazing. We wish it was more, but I really think for a brand new thing, they're doing pretty well with it. It will get better. I think vaccine allocation will loosen up, we'll get more. There should be another product or two coming online, we hope, in the next few weeks, which will help this. So don't give up, keep trying, and get vaccinated when you can. It's a great thing. It'll change your game. Thank you.
All right. Well, thank you, gentlemen. I appreciate your participation today, and always. It's so important that we have a chance to sit down and try and get this information out, as it, like you say, it's happening so quick. So we will be back in 2 weeks, but please stay tuned to our local media outlets and for any changes that occur. Hopefully in the next 2 weeks we'll have more information. But thank you again to Dr. Remington and to Kurt for your help today. Remember, there's some resources available on the city website with regards to vaccine education. Testing continues. We're still red, which means diligence, mask wearing, and care in all you do. We'll see you in a couple weeks. Thank you, gentlemen.
Thank you.
Have a great day.
All righty.